Right. Hi, everybody. Welcome. Welcome. Okay, there's I think a few people still connecting. Okay, welcome everyone.
Thank you.
For participants, please stay muted. You're welcome to have your video on or off. That's up to you. Welcome everyone. So we're going to start with introductions. Oh, you know what? I'm gonna make Shemika, I'm gonna make you my co-host. While I do my intros, if you see people in the waiting room, will you please admit them?
Sure.
Okay, cool. Thank you so much. Forgot about that part. So, hello and welcome, everyone. This is panel discussion, supervising trainees, co-leading groups with each other. This is put on by the AGPA, College Counseling and Other Educational Settings, SIG. My name is Ksenia Zhuzha. My pronouns are she, her, hers. So I will be serving as a moderator for today's panel. I'm a psychologist and group coordinator at the University of Nevada, Reno Counseling Services. I'm also the education chair of the AGPA College Counseling SIG. I'm connecting to you today from Reno, Nevada, which is traditional territory of the Washoe and Northern Paiute Nations. So before I introduce speakers who are with us today, I want to say a couple of words about our SIG. So AGPA conference is coming up, and if you are attending, we will have SIG events. We will have SIG lunch during one of the conference days specifically. I don't believe we identified that yet, but if you are, you will be coming through the listers. So keep an eye on that. We're also going to have a social hour on Wednesday. We do not have the time or the location yet, but so please keep an eye on that as well. The cool thing about SIG is, our SIG, is that even if you're not a member of AGPA, you have the access to some things that we put on. So panel discussions on different topics is one of them. We also have free consultation groups for people in university college counseling centers. Consultation groups are organized by Vinny DeHilly, and he leads them. When you participate in one of those consultation groups, those hours can count towards your CGP, which is pretty amazing. And so again, you do not have to be AGPA member to do that, and it is free of charge. Of course, AGPA membership gives you a whole lot of other benefits, and conferences are amazing. But if you are not a member, you're still welcome to join us and participate in things that we offer. All right. Oh, and one more thing. So we are also have mentorship program through our SIG, where we pair up mentors and mentees. And we do not have sign up for that yet. They'll probably be coming out after the conference. So keep an eye on that as well. It'll be coming through email. You can sign up to be a mentor or mentee. And that's a pretty awesome program. Okay. So who we have with me today? First, you'll see on your screen Shemika Brooks. She is a certified group psychotherapist, AGPA fellow, psychologist, and group coordinator at Johns Hopkins University. In 2022, which is just last year, Shemika developed a process group immersion 2-day program for trainees in college counseling to participate essentially in a marathon group, which is 8 sessions across 2 days. Shemika also works in private practice and provides psychological and consulting services through her business. And the name of that business is Meek Mind LLC. All right, we also have with us Wendy Gonzalez-Canal. She's a psychologist and assistant director and group coordinator at Pace University. Wendy also has a private practice. And last but not least, we have with us David Panzer, who is a certified group psychotherapist, psychologist, and the director of group psychotherapy service at the Graduate School of Applied and Professional Psychology of Rutgers University. David is the recipient of the 2013 Harold Bernard Group Psychotherapy Training Award, and also has a private practice. So welcome all of our panelists. It's a real pleasure to have you all, and thank you so much for spending this time with us. Before we begin, and I'll let our panelists to take the reins, I would like to give a brief overview of Zoom and the format of this presentation. Let's see, automatic live captioning. I have not turned it on. Let's see. Okay, automatic live captioning should be enabled for this event. You can usually turn it on and off by selecting the closed captions icon on the navigation panel at the bottom of your screen. Usually it is at the bottom. I should be on my end. Okay, so your microphones will be muted as you enter, so please stay muted. For the first portion of this presentation, this is to eliminate background noise that can be disruptive. If you are seeing myself and our three panelists in the center of your screen, you're in speaker view. It is the recommended setting for this webinar. However, you have an option to switch between gallery view and speaker view, which will allow, gallery view will allow you to see more participants on the screen. Okay, and you can switch between views by clicking on speaker gallery view, which is usually located in the upper corner of your screen. So we are being recorded. Once the recording is uploaded to YouTube, AGPA YouTube page, all of you will receive an email with a link recording. Sometimes timeline for that is depends on AGPA and their availability. So usually it's between 1 to 4 weeks. Please be patient for that. Okay, and in terms of structure for today, the first hour, the panelists will discuss their approach to supervising trainees, co-leading groups with each other, and answer questions I've prepared for them. And then the last 30 minutes of the event will be devoted to questions from the audience. If you have questions for the panelists, please hold your questions until the Q&A portion. To ask a question at that time, simply unmute your microphone and ask it out loud. For accessibility reasons, if you are unable to ask a question verbally during the Q&A portion, you can write it in the chat. But if you are able to ask it verbally, I ask you to do that because I'm the only one person moderating it, and it's difficult to keep track of all the questions that come in through chat. All right, so with that, I will turn it over to Shemika, or no, not Shemika, Wendy. I'll turn it over to Wendy to begin our discussion panel and tell us about the group program at her center.
Thank you. Hi, everybody. Thank you for being here today. I am Wendy Gonzalez-Canal. I am the Assistant Director and Group Coordinator at Pace University's New York City Counseling Center. Pace University has 2 counseling centers, one in Westchester, one in New York City, so I'm at the city campus. We have about 8,000 students. And our program runs usually on average about 7 groups per semester. That is groups / workshops, and I'll go into that in a minute. So we offer process groups, psychoeducational kind of drop-in skills groups, and workshops. And we have extern level trainees, so practicum students. Those are students who are at the very beginning of the doctoral program. So these are going to be first-year students. And we also have doctoral intern who are doing their internship at our site. So the structure of essentially what we offer shifts depending on which group of trainees. So I'll try to do that in the most organized way that I can think of. But essentially our externs, our practicum students, co-lead are more skills-based groups, and they do that without the presence of a senior staff member. So the way that works is I meet with them on a weekly basis, and that is for them to learn the material. So they usually have reading material assigned in preparation for that, and we'll do some role play, and then that week they teach that particular topic. So there's 1 group and 2 workshops that are run in that way, in that format. The group is an ACT-based group. That is our stress management group, and it runs for 6 weeks. It's drop-in, so students can essentially they don't have to commit for the entire time. Like I said, it runs for 6 weeks and we're running twice in the semester. So a set of trainees run that throughout. And then, like I said, they meet with me once a week for 45 minutes. And then the other version of that, so we have 4 externs. The other 2 externs run our DBT workshops, which are 3-session workshops, one on assertiveness training, one on reducing emotional suffering. So they're sort of DBT inspired. They don't follow the full DBT protocol, of course. And then they get to choose which one they get to lead twice. So essentially they lead sort of 3 workshops, but 2 of those are the same one that they repeat. And similarly, they have a script that they read through. I have them read the material beforehand. We talk about it, clarify anything that, any concepts or anything like that and how to deliver it. And we talk about anything that happened the previous week. So that is our externs training. And then for our interns, they co-lead process groups, interpersonal process groups. And we have a 15 to 30 minute debrief after each of the groups, and also a weekly group supervision where we watch tape of their sessions or prepare at the beginning of the semester for the groups. And there's also a monthly Friday seminar where we actually watch one of my process groups that I run throughout the semester, and I kind of walk through my own difficulties and my own struggles in leading the group. And I usually try to make sure that I'm selecting sessions where I struggle with something similar that they're struggling with. So whether it be a very quiet group or a very active group, and kind of try to do it in that way. So I think that is the best overview that I can give of our program. And I think I'm handing it over to David.
Okay, I'm David Panzer. I am the Director of Group Psychotherapy Services at the Graduate School of Applied and Professional Psychology at Rutgers University. The university is rather large, spread over 3 campuses. There are about 60,000 students, very few of which we actually have much contact with. Our program has 200 students spread out over 4 or 5 years. We accept 18 students into the clinical program and another 18 students in the school program within the graduate school. All of the students who are in the program, whether they be school students or clinical students, are eligible to apply and participate in our training program. All students that are eligible to run a group have to have taken a course, Introduction in Group Psychotherapy, either at our graduate school or at another university where they may have taken a course before transferring to our school. And the requirements of that course is that you be a participant in a didactic portion, experiential portion, and reflection on the experience. It's a course that once upon a time I taught. I no longer teach it. I've kind of passed it on to a new generation. Was that Shemika?
Said, who's teaching it?
Terry.
Oh.
So this was the first year of the transition. Once somebody has completed a course, then they're eligible to be a participant in running a group. And the format of the group, as of very recently, is they apply for a participation in a one-day practicum. So the entire program is housed within a practicum format. Within that format, they have an opportunity to do intakes and make a recommendation for group therapy, which we consider to be a very vital part of somebody being able to run a group, to actually have the feeling of making the recommendation and take ownership of the group that they're going to be running. And then they have the opportunity to sit in on a weekly supervision group, which I run, before they actually start running a group. They're expected to be active participants while they're observing in the supervision group. I'll talk about the structure of the supervision group in a second, but assuming that everybody, whether they're running a group or not, has their own opinions about what should be done within the groups that they're listening about, the expectation is they're active participants in giving feedback to those who are running groups. When somebody is in a position, or when we're in a position to offer a group or start a new group, when the demand exists, we start students off in co-therapy dyads from day one. The thinking behind that is, and I can go into more detail if we have the time, I'm a strong believer that students really need to learn their own style of leadership, and they're more likely to cultivate their own style of leadership if they're not in a hierarchical leadership relationship from the beginning. It was very interesting. I was listening to a quote from Jeff Bezos just the other day, where he says when he runs a meeting, he's the last person to speak. And he's the last person to speak in a meeting because he doesn't want junior members of his staff to be influenced by what he wants to say. He wants to hear what they have to say. And it's kind of parallel. If you have a junior member, a trainee working with the established group therapist, my concern is they'll really overlook their own thoughts, their own interventions, and defer to the person in leadership. So I like the idea of two equal partners kind of cultivating their leadership styles together. So they have an opportunity to run a group. The groups that we run through the clinic, and the clinic is housed in a specialty clinic where there are 10 different specialties. Group therapy is one of them. It's housed within a clinic, and excuse me. And the patients that come through, or clients that come through, can be university students, but are not limited to the university students. It's a fee-for-service clinic. People are from the community. And so what that gives our students an opportunity is to work with a full range of people that they're hopefully going to be working with at some time in their career. So we have groups that have students as young as 19 or professionals as old as 65. So we have a full range of students available for a full range of clients available for students to work with. I think I'm getting a little carried away here.
Thank you, David. I think this is maybe a good to start with, and I'm excited to ask you more questions. So, and it's great to have somebody from academic program today on the panel, so that we have a little bit of a different perspective, maybe different ideas.
Can I just add one
Sure.
thing? Students are in a weekly supervision group. All students that are running group are also in individual supervision with someone in the facility that they may be running a group in, or by a private practitioner if it's not housed in a facility. And the co-therapists meet together with the supervisor on a weekly basis.
Perfect. Shemika, how about you?
Yeah, very happy to be here. I am Shemika Brooks. I use she, her, hers pronouns. I am the group coordinator and a staff psychologist at the Counseling Center at Johns Hopkins University in Baltimore, Maryland, where I am today, coming from the lands of the Susquehannock and the Piscataway Indigenous peoples. I'm also a graduate of the Gazette program that David is referencing, the group psychotherapy services program. And now as a group coordinator at Hopkins, I co-facilitate a process group with each of our 4 interns as they enter the internship program in the first semester. And our interns are also given the opportunity to facilitate a second group, most often in the spring semester. And as a part of the options that they have, they can team up with another permanent staff member to co-facilitate a group with them, or they can team up with another intern if they want to offer a new group together. Most often, the interns pairing up might offer a skills group or a support group as the default, but if they have demonstrated competencies in that first semester when they're co-facilitating with me or even with another staff person, and they advocate for themselves to facilitate a process group, then they are given the opportunity to do so. Most recently, we've had one of our previous interns who was very involved in Dungeons and Dragons and wanted to offer a Dungeons and Dragons therapy group. And none of the folks at Hopkins had any familiarity with it, nor did any of the staff volunteer to co-facilitate with the intern. And so he actually teamed up with another intern to offer it as a therapy group. And he and his co-facilitator both demonstrated that they had a good understanding of process work in the group space. And so that's one example of when an intern has been able to create a new group, co-facilitate with another intern. They were supervised by me. We met weekly following their group for a half hour to discuss the session, any processes that occurred, and to do planning for the next session. We do not currently record sessions, so I was not able to see them in action, but the supervision and the way that it was structured worked out for us, and that former intern is now a staff person and continues to run the Dungeons and Dragons group. So yeah, that's me. That's how our program is structured. Happy to answer more questions.
Thank you, Shemika. Well, that's brave of trainees to do D&D. I mean, D&D is in the bulk group with another, with a peer, but that's pretty awesome. Okay, so we'll get into our questions. So my first question, David, you already talked a little bit about this, but maybe we'll hear some more and from others as well. What are some of the reasons to have trainees colleague with another trainee as opposed to like a senior staff member, and what benefits do you see? Wendy, I don't think we've heard as much from you on this point yet, so start us off with this question, please.
Yeah, so I became the group coordinator at PACE, I can't imagine, 2.5, 3 years ago. And that was the way that the program was structured, which was actually new for me because I come from a training model that's very different, where you are always sort of leading with a different senior staff. And I was a little hesitant, so I'm going to be completely transparent. I was a little hesitant about it, but now after doing it for 2.5 years, I actually find that the trainees are able to develop a little bit of what David shared, are able to develop a little bit more of their own voice, and they get to kind of experiment a little bit more than I think they would if, say, I were to be in the room with them. There's, I think, less hesitance for them. So like I had mentioned, we have both interns and externs. And I think for externs specifically, one of the reasons why I make sure that they lead the same workshop or skills group twice, is because I definitely see that confidence build for them. And one of the things that I really encourage them to do is think about the decisions that you're making. If you have one person present for the group, right? Only one person showed up, versus if you have 8 or 9, right? Like, what decision points are you making there? So I think of it as really an opportunity for them to develop the way in which they think about group leadership and develop their own identity and their own voice as group leaders. And for our interns, they really come in with very different levels sometimes of experience. And I have found that even those who have had the experience of leading with a senior staff member sometimes get this sort of added freedom in being able to lead with a peer that I don't think they would get if they were then leading with me, as they're trying to please me, who's also the person who is, evaluating them at the end of each semester. So yeah, to be completely honest, I don't think it's something that I would have done if it wasn't already in place and I sort of followed, but the feedback each time has been really, really positive from the interns and their experience, and in my ability to see their skills grow from week to week and semester to semester.
Thank you. Sounds similar reasons that David had mentioned earlier. David, do you have anything to add to what you had already told us about this?
Yeah, I always have something to add. For me, the true value in having co-leaders that are at similar levels of development, similar levels of training, is that if we're talking, and I have in mind the fact that we're talking about primarily process groups, and I know that a lot of people run different kinds of groups, but within the framework of a process group, I think it's really, really important for co-leaders to go through a process themselves that in some ways reflects or parallels or sets the tone for what the group is going to go through. And so they do go through a developmental process. And while they may not necessarily work through differences within the frame of the group session, the fact that they actually have to figure out how to cultivate their own relationship and how to enhance their relationship as kind of a precursor for being able to help the group develop their relationship and feel the true benefit of not just feedback, but cohesiveness and a sense of belonging and a sense of that being the basis of growth that may take place. So what I've actually had the opportunity to experience through my students has been seeing the evolution of their relationships much of the time, seeing the barriers to the evolution of those relationships, and in some cases see those relationships not be able to work out. And for students to actually have the opportunity to reflect on themselves and reflect on themselves from a countertransference point of view, reflect on themselves from a here and now point of view in their relationship with the co-therapist, I think is immensely important.
Thank you. Shemika, I plan to ask you this question a little bit later on, but this feels actually like a really good time. You were a student in this program, so I'm curious, how was your experience with this model as a trainee?
Yeah, so I started in the program in my first year of my doctoral training, was able to join the intro course in my first semester because I'd taken a previous group course during my master's program. So that wasn't the case for most students. Most students, had to take the course first and had to wait until after their first year to get into that course. I was able to start from the beginning of my training, and David and my first co-conspirator, co-facilitator, Joanna, made a plan to have me co-facilitate group starting in midway through that semester. My experience was really positive. David is the reason I drank the Kool-Aid, as they say, and went to AGPA and have been there ever since. I think there was definitely lots of benefit to being able to co-facilitate with another student. And Joanna was a student who was a year or two ahead of me, and so a bit more senior, but still someone that I saw as a peer. And so what David's saying about developing a sense of confidence, developing that relationship, all of those things, I was able to experience from the very beginning. And that had a really positive impact on my taking to group as a modality, right? And being a group facilitator as a core aspect of my identity as a psychologist. I think it would be possible for me to get to where I am through a different model, but I think that model was a large part of what made me fall in love with group and with the process. So I think that I think very highly of the model that is represented through GPS at Gazette.
That's pretty amazing. So
If
on
I
that
could
note,
if I could just make one quick comment on what Shemika said. Even though we try to reduce the phenomena of a hierarchy by not having established professionals running, we still see it. And I think we still see it because a new member to running a group thinks somebody that's run it for 1 year more than they have is an expert. And so we do still face the issue of how to work through that hierarchical relationship, but we try to minimize it.
Shemika, so also at your current center, trainees sometimes lead groups with one another, in particular process groups, but at the beginning, from what I understood, you said they generally co-lead with a senior staff member. So curious, what led you to make this choice as opposed to modeling like off the graduate program and their system?
Yeah. So it was not typical of trainees to be allowed to co-facilitate groups together before I came in. So even introducing the concept of trainees co-facilitating groups together in the second semester was something that the folks in my center had to digest. But coming from the model that I did, I was able to give a good push for it and to see it through and to support it, and also to generate support from other staff. A part of the reason I've not introduced the idea of trainees co-facilitating group from the very beginning is if I knew that all of so we only have pre-doctoral interns at the counseling center as trainees right now. If I knew that all of our interns were coming from GPS or a similar program, I would love to have them co-facilitate group together. But the reality that I've faced, and that actually goes into why I developed PGI, the program that I did last year, is that it's pretty common for me to have at least 1 or 2 interns a year come in and I say, we're going to co-facilitate group together and I want you to be yourself. Like, don't watch me and try to do what I would do, but develop your own interventions, develop your own style. And one of the first things they say is, well, I've never even seen a process group. So how do I do that? And it is very challenging for trainees to show up as themselves when co-facilitating with a more senior person, with a permanent staff person. It's even more challenging to turn over the reins to them when they've never seen it in action, never taken a course, or they've taken a course on group dynamics and not group psychotherapy, which are different. And if we had the time to go through an entire group course before they enter their roles as co-facilitators, then yes, I would definitely be advocating for our trainees to be co-facilitating together. But the reality is that we don't have enough time to do that before they start co-facilitating. And so I really want to ensure that they not only get the skills in a didactic form through our seminar as they're going along, but that they're able to demonstrate those competencies that are required in order to allow them to co-facilitate, especially without us recording our sessions. So that would be another thing that might change it and allow them to do so sooner. But the reason they co-facilitate with a permanent staff person is because they come in at different levels and they're not all coming from a program like GPS. And so we have to do the catching up before we can do the release.
Yeah, and this actually leads into the next question I wanted to ask you all, which is like, what training or preparation do you have for your trainees prior to them leading a group together? Meaning not including the ongoing supervision, but like prior to them jumping in. David, you already mentioned which courses trainees take. Do you mind maybe including like a brief summary of what that is? And then we'll also hear from Shemika and Wendy on this.
Well, all the students are required to take an intro to group psychotherapy course. And like I mentioned, the course is split between didactic material, very consistent with what's required for membership in AGPA, and also be a part of a process group. The process group was a group that I ran when I taught the course, and now that someone else is teaching the course, she is running it. It's debatable about whether the same person should be doing the didactic and the experiential, because that's even within the time frame of a 2-hour and 45-minute class, it's difficult for students to transition from one format to another. But that's what we've done, and we touch on, your basic group development dynamics, issues of diversity, selection and preparation of people for group, how to make a recommendation to groups. So like I said before, our students are actually involved in intake evaluations where they have to make a recommendation for somebody to be a member of a group. We touch on specialty areas, time-limited groups. For example, we touch on basic theory of psychodynamic object relations theory, which is the framework that I and my groups function from. What else do I cover? Therapeutic factors as outlined by Yalom, teach students to actually understand the therapeutic factors as more than something theoretical, something that they're going to use when they're making a recommendation, something that they're going to use from time to time, looking at the developmental process of the group. So we cover your basic intro courses, materials. The only thing that we do other than the experiential course is that I do some role playing with them about how to make a recommendation to be in group, because oftentimes students do not feel comfortable with making that recommendation until they feel comfortable with what it's like to be a member of a group. And so we actually spend quite a bit of time talking about how to make that recommendation without feeling like you're making a sales pitch. And issues of termination. So we try to cover the full range of topics that they'll need to know before they get in their room. Talk about, one other thing is, while I am psychodynamically oriented, We spend a lot of time trying to help students see that you're looking at a collection of individuals, and those collection of individuals are forming relationships with each other, but they're being done in a group system. So one of the things that I think is really important and challenging for students to learn is, you know, what are you looking at when you're looking at the group? Are you looking at a collection of individuals? Are you looking at a system, and how do those interact with each other? So those are some of the key issues that I think are important before running the group. So if the students have some kind of a really respectable grasp of that, then I feel pretty confident letting them do it without a senior supervisor being involved in the running of the group.
Thank you, David. And Shemika, you mentioned also like developing actually like a 2-day prep for your interns, I think, right? Tell us maybe a little bit what that's like, and if you have any didactic too, in addition to the marathon group you mentioned.
Sure. So as I mentioned, that program was developed in response to hearing from some interns at the very beginning of their year. You know, I don't really have a lot of group experience, or I took a course in group, but didn't really get a sense of what that would look like in action. And actually, Wendy was one of the facilitators of one of the small groups for the program last year. So that program is a 2-day program. It was kind of modeled after AGPA's 2-day institute, where it's 8 sessions across 2 days. We did do an intro portion at the very beginning on the first day to just give a sense of, professional development process group is going to be different from a process group for therapy purposes. And it may be therapeutic, but it's not therapy. And gave a brief touching on what that was and orientation to the task of participating in a group over 2 days. And then at the end of the second day, we did a recap. We emphasized some of the concepts that were highlighted during the experience. The facilitators gave some reflections. And then we put together a handout of the takeaways that were discussed in that last session for the participants to have as they entered their training year and their potentially first experience as a group co-facilitator. So that took place in August. It was in the 3rd week of August. And really, it was very important for me that it did take place during the orientation period before they start co-facilitating, so that they have at least one example. Some people have more than one example. Some people weren't new to groups, but all of the interns that I co-facilitated with this year were able to reference their experience in PGI and what they saw their facilitator do during that program as they developed their own styles as a co-facilitator. And it took place at the end of what is our 3-week orientation period at Hopkins. And so there were folks that wanted to participate, but were like, oh, it's just not a good time for us. But, you know, it works for some, it does not work for others. But that was the purpose, was to give at least one experience, and an experience that's only with other trainees, right? As a student, I was going to AGPA again from the very beginning of my doctoral training. I was in process groups with people that I was always looking at and saying, is this going to be my supervisor in the future? How messy can I get? How can I respond to other people's messiness if I'm really worried about, like, I can't be myself because this could potentially be a supervisor. This could potentially be an employer. This could be potentially be the director of a site that I applied to for internship. And so it's really important for me to have facilitators who were familiar with the College Counseling Center context, had particular expertise, training, and for all the members to be trainees. So that gives them that kind of experience as they're entering their training year. So it'll be the third week of August again on the Thursday and Friday this year coming up. And I'm really looking forward to continuing it. And my interns have continued to reference the experience throughout the year without prompt. And that really makes me happy. It shows that the intentions of the program really shone through. So
it sounds like that was very much needed, and what a great training for new interns. So how many people would be in the group? Like how many trainees?
So the registration was open, and we had in mind to have up to 8 people in a group, and we were planning for 7 groups. 7 groups, yes. And the idea was also to split trainees from the same site into different groups. And if there were any sites that had more than, let's say, 7 trainees, then they were split by training level. So master's interns would be separated. The pre-doc interns would be separated. Social work students, prac students. And so a prac student might be in the same group as a social work intern if their site had a lot of trainees, but they wouldn't be in the same group with anyone from their cohort, nor was anyone in the group facilitated by someone from their site. So none of my trainees were in the group that I facilitated. So those were some of the things that were taken into account to formulate the groups. We did, it was the first year. We had some folks sign up but not show up. We had less sites registered than we had the space for. So the groups were smaller this year, but I anticipate that they'll get larger and we might get closer to 8.
So if sites wanted to jump in on participating in this, is there like a process? Could we send information to participants here post session?
Yeah, so I'm actually planning to hold an info session for folks working in training sites who might be interested in learning more about the program. And I'll pull up that flyer and drop it in the chat here.
Yeah, and I can also circulate it when I send out a recording, so we'll so we don't spend much more time on this. But thank you. I'm excited to learn more about that as well. All right, and Wendy, how about you? What kind of prep do you do with your trainees prior to them co-leading with one another?
Yeah, as I was listening to, everyone else talk, I'm like, I want to do more. And that's my problem. I always try to do more with very limited amount of time during orientation week. But so all of our trainees, doctoral, our interns and our externs, they get sort of this baseline, and David's a little bit of kind of what you were talking about in terms of how to make the recommendation of group, and I actually do call it selling it because some of them don't have the experience. So I think if I can sell it to them, they can sell it to the clients who are a good fit. So the first exposure they get in terms of training is what are the groups? Who is a good fit for this group? Who is not a good fit for this group? How do you make this recommendation when you're doing a screening, even when they've selected that they're not interested in groups, but one of their goals maybe would actually be a really good fit. So that is kind of one of the first things that they get during orientation. And then each subset, so then with the externs, I do a specific training on the ACT modules that we go through and the DBT modules that we go through for the skills-based groups. And I acknowledge that there will always be a subset of those who are leading in the spring who will have completely forgotten about everything that they went over during the session. So it's really kind of a general overview so that they understand what the skills-based group is about, and what the structure is going to be like. And for the interns, it actually bleeds a little bit more into the semester before they actually start leading the groups. But they get kind of a general training of what our process groups look like, how to make the recommendations, and then what are some, so the first couple of weeks during our supervision, because we don't have groups to watch and we don't have anything to review, I actually do a little bit more didactic. So there are certain kind of didactic lectures that I give where I try to fit in as much of a intro to group psychotherapy class as I can. That it includes things like the therapeutic factors, how to do a pre-group meeting, right? How do you orient somebody into group? What are the dynamics that we're looking for, and how to start thinking more of the group as a whole, right? And when you start building your group, you know, we don't have specific group topics, but you know, if you have a couple of members who look like this or presenting with this, how do you then select for other members to make sure that this is a group that is going to, you know, develop cohesion and things of that nature. So, so that's what happens at the beginning. And then as the semester goes, the externs who are leading the more, and I think I alluded to this a little bit earlier, who are leading the more skills-based groups, each week we actually discuss the topic at length in supervision that they're going to be teaching, clarify any concepts that they're not very sure about. You know, for that, these are externs. Sometimes they haven't even had a class on, say, like cognitive behavioral skills or anything like that. So we go through it, and sometimes they're a little bit confused about the term, so we talk it through. And I always encourage them to tell me anything that doesn't make sense to them, because I say you're likely going to have somebody for whom it also doesn't make any sense. So really encourage them to, you know, to be honest and kind of work it through. And then for our interns, you know, I mentioned the more didactic pieces, but also there's training on co-leading. So once they have their co-leadership partnerships, we do sort of like the 1 minute co-therapist, what are you like, talking about their personalities in general and how might that translate into their group leadership skills. Like, do you tend to avoid conflict? Do you tend to move towards conflict? And things of that nature, and how do we kind of bring that in?
I want to keep spotlight Wendy on you for a moment longer, but before I do that, now we're coming close to the end of an hour, and I know maybe some people are departing at the end of this hour, not staying for the full program. If that is the case, I am sending you a link to the feedback survey in the chat. Please complete it. It's super short. All right. So, Wendy, I was also wondering, given that you do group supervision with trainees, co-leading groups like during the semester, do you ever feel like the time is not sufficient to provide everyone with the support and guidance that you want? How's that?
Yes. So when I actually started, we only had our ACT-based stress management group for externs. That was the only group experience they got. And for our interns, there was we just had a once a week, 1 hour that was supposed to be seminar and supervision. And immediately I was like, this is not enough. This is not enough time. So I developed a monthly seminar for the interns and added on the 15 to 30 minute post-group debrief. Because I was finding that after that first year, that hour, we always ran out of time, and whoever presented their group first got more time. I tried to switch every week, but yes, I'm constantly feeling like I'm running out of time. Also because I can talk about group all day. So I'm not sure that my trainees feel like there's not enough time. But Yes, so not so much for the externs who are co-leading the skills-based group. That feels more balanced. But for the process group supervision, yeah, I always feel like I could use an extra hour. So if supervision was 2 hours. But it helped to add that 15 to 30 minute post group debrief.
So we got a little bit into the challenges. Given that we're running out of time, I will not be able to ask all the questions I wanted to of the panelists. But how about we tap into the challenges a little bit before we go into Q&A from the audience. Shemika, how about you? What common challenges have you encountered in supervising trainees who co-lead with one another? And how is that different, maybe supervising trainees who co-lead with you?
Yeah. So in my case, it's always been the same group. We have 4 interns. And for the past 3 years, I've co-facilitated with each of them. Challenges include when I wasn't co-facilitating with everyone, expecting that the person who's co-facilitating with an intern is giving them the same level of experience as the other interns are receiving. One year I ran into one intern who was supposed to be co-facilitating another group. They were assigned another staff person who has group experience, and that person just never got their group off the ground. And so that intern for the fall semester didn't have any group experience. Challenges have also included being a gatekeeper, right? So because we've gotten interns at multiple levels of development with regard to their identities as group facilitators, their familiarity. Sometimes that first semester is the only chance that we get to get a sense of their competencies. And every now and again, you run into challenging trainees that aren't receptive to feedback, that really don't take in what it is that they're receiving feedback on, and who don't demonstrate the competencies. And in those cases, when those trainees at our center say, I want to run a process group or a therapy group, I end up being in a position to say, well, actually, we can't have you do that. So let's rework the plan. Let's see how you can get some more group experience. But it will not be in a process group or a therapy group with another intern, right? So it can be challenging to put the brakes on when folks are expressing enthusiasm and wanting to co-facilitate specifically a process group, and we are in a position to say, you're not in the place where you're able to do that yet. So those are a couple of the challenges that come to mind immediately.
David, how about for you? What challenges have you observed over the years?
Quite a few. First of all, students sign up to run a group, and they frequently are very frustrated and surprised at how long it takes to start a group, unless they're filling in for an existing group. That somehow people's schedules should be available, and you should get the kind of referrals that seem to fit together for a group, and the evolution of starting a group can be very frustrating for students. Another challenge is, while I run a supervision group, they're also in supervision with individual supervisors where they spend an hour per session talking, looking at videos, talking about what goes on in their group, talking about their therapy relationship. Initially, they're totally confused as to why they need 2 supervisors, not really appreciating the difference between individual supervision and group supervision. It takes a little while to get used to that. Every once in a while, there's a little bit of conflict between me and the supervisor. And I have to remember that I actually have a co-leadership relationship with all of these individual supervisors as well. So that may require some active involvement with them. And that has come up in some actually rather painful ways at times. And the other thing that I jotted down was that there is frequently a very high level of anxiety that students have about beginning the process. They don't think they know what to do. They're graduate students. They think they're going to be evaluated harshly. They don't know what it's going to be like to actually work with somebody else. They oftentimes want to run a group with someone that they already know that's a good friend of theirs, not realizing that that could actually put their friendship in jeopardy, depending on how well they work together or don't. And so it brings up lots of anxieties that need to be addressed.
Thank you all so much. So it is we're to Q&A portion from the audience. To ask a question, please unmute yourself and speak question out loud. If for some reason you're not able to do that, you're welcome to send it in the chat to me. Or if it comes to everybody, that's okay. If there's, for some reason, there's not enough questions from the audience, I have plenty of questions I can ask. So we'll turn it over to the audience. What questions do you have for panelists? Okay, I have one question that came through from Daniel. Daniel says, I'm a private practice psychologist and run several ongoing interpersonal process groups. And I also supervise both master's and doctoral students in individual therapy and psychological testing. Being involved in a group is an experience that all of my trainees want, and yet, as the panel suggested, the hierarchical structure, the dual relationship of co-facilitator and supervisor, along with the already formed relationships that I have with group members, makes it very challenging for trainees to intervene. It almost feels like an impossible task. What suggestions might you have to make this a positive and impactful experience for trainees? Shemika, I'm wondering if you're maybe a good person to answer this question.
That is a good question, and that could be a panel in and of itself.
Which probably will be.
But it is something that I do enjoy doing. I do enjoy co-facilitating with the interns and pushing them to develop their own identities. And so one thing I do is to emphasize that from the very beginning. In the orientation period, when I'm kind of giving an overview of group services at our center, and then an overview of the expectations with regard to group for the training year. And then I meet with each of them individually to begin our co-facilitator relationship and emphasize it as much as I can in that space as well. I think it does take more on the part of the co-facilitator, who is the supervisor, to not enact their role as a supervisor and to elevate the voice of the trainee, especially when you're having those post-group meetings and conversations. And, you know, my experience is the trainees will say, okay, here are some of the things I thought about saying. And it's like, well, the group missed out because you didn't say those things. And you're not going to think of what I'm going to say, and I'm not going to think of what you're going to say. And so when you hold back, the group is missing out. Another thing I emphasize is there are some wrong things to do, but there are lots of different stylistic things in terms of how you facilitate group, right? And so if and when a line gets crossed where it's we cannot do that, and here's why, then I'll put on my supervisor hat and I will give that feedback. But for the most part, I challenge the trainees that I co-facilitate with to say and do the things that they are worried might be wrong, so that we can actually get to learn where that line is, right? 90% of the time, the things that they were hesitant to say or do are absolutely fine in a stylistic thing. And it's like, look, that's probably your style as a facilitator. And then, you know, when again, something happens where it's like, here is why we cannot do it in this way or should not do it in this way, then I'll actually say, okay, now I'm giving feedback about an intervention that you made. Let's look at this from a supervisory perspective. I also, when I give suggestions, say, this is another way to do this or another way to look at it and not the right way, right? So it's really a factor of managing your roles and emphasizing from the very beginning what you would like in terms of facilitators stepping in and showing up as themselves for the benefit of the group. If I can kind of capture it really quickly.
And as Shemika mentioned, we'll do plan a panel on this later on, so we will not talk about the specific topic too much, but I would like to invite you all to ask other questions about supervision.
Can I jump in on that one? Can I jump in on that?
David, if that's okay with you, I'd like to see if there's questions specific to trainees, supervising trainees who co-lead groups with each other, because I want to focus us on this topic a little bit more, because there's a lot of technicalities here. But if we have time, maybe you can add a few points. So what questions do we have? Please unmute yourself and ask a question. Well, I have a question. I have a question, David, for you specifically. You see students lead very different groups. Well, actually, Wendy, I think this question may apply to you as well, because you have externs who lead the structured groups, psychoed groups, and then interns process groups. So given that there are different groups, and especially, David, you see students do groups that vary in duration and type and population. Are there groups that tend to be easier and groups that tend to be harder for students to co-lead without an established clinician being in the room with them?
I wish I had a good answer for that. I don't. You know, I think that the challenge that students have when they're running, let's say, a time-limited group, is that there's really a tremendous amount that they have to be juggling in their own head about what's going on and what they need to do, and feel the pressure of doing it quickly. My experience with students is they operate with the assumption that they're supposed to complete the task in the 12 or 15 weeks that they have. And they don't appreciate the fact that, you know, in many cases, the work that somebody is doing in group is a longer term process. And they have to accept the fact that working in a time limited format doesn't necessarily give them the opportunity to work through things with patients that a longer term group would give them the time to do. So if, you know, as someone observing and supervising such a group, you kind of want to help them regulate themselves in terms of their own expectations. And that's very different than when you're working with somebody with a long-term group who, like Shemika, has the opportunity to run a group for multiple years and can pace themselves differently. That's probably the most striking difference. I mean, if you're talking about someone who's working with a teenager, how you frame the group, how you set boundaries for the group, how you take into consideration the intrusion of the school system on what you're trying to do with the group, These are all variables that you have to take into consideration. None of which actually automatically challenges trying to help the group evolve. These are just variables that affect it.
Mhm.
I would
Yeah.
say, oh,
Go
sorry.
ahead, Wendy. I was just going to say that we at UCCs probably can relate that it's challenging to have time-limited groups and you want to do everything at once, and always that time pressure is happening. Go ahead, Wendy. Sorry.
Yeah, I was just gonna say, I think the anxiety is always there for trainees. It's just, where is it being sort of sent to? Because I think my externs who are doing the more structured groups that have a script, I think there's a certain level of like, oof, okay, like I know what I have to say because it's in the script. And then I bring in the anxiety of, well, I don't want you to follow the script 100%, and I don't want you reading off of the screen. And I think some of what they would anticipate would remove the anxiety, then adds some of the anxiety. And there's difficulty because there's material that they're not familiar with that they have to learn enough to teach. And I think that is sort of its own beast in a way, to have to do that. Whereas for our interns who are leading the more process groups, it's the anxiety of, you don't know what's going to happen in the group, and you have to be ready to handle whatever comes your way and sort of accept and trust in the group process and trust in yourself in order to be able to, in order to be able to intervene in that moment. And so I would say the anxiety is different. And I would argue that trainees likely would say, oh, if I can do the structure group first, but I don't necessarily think that it's any less anxiety provoking. I think the anxiety shows up in different ways for them.
It's interesting because with my students given a choice of doing a time-limited group or a long-term group, a sizable percentage would pick the time-limited group because, if I don't like this, I can get out of it quickly. And I think that's just a reflection of the anxiety. And if you can provide them a structure, that is helpful automatically.
Yeah, that's a good point. I do have a question that came through the chat that I'm going to read in a moment, but I'm wondering if it's maybe difficult to unmute and ask a question. So given that I haven't been flooded yet, like if it's easier for you to type a question in the chat and send it to me, please go ahead and do that. So question from Jose. When you supervise trainees co-leading process groups with one another, what are the ways you support them navigating transference and counter-transference? I don't know who may be best to answer this. So.
I can start us off with this one. Sure. In my experience, really emphasizing the co-facilitator relationship has been beneficial. The way I conceptualize transference and countertransference, it can be really hard to pick up on when you're a part of that enactment. And often it is going to be the co-facilitator that points something out that gives us a hint that that might be what's going on. And so really asking to hear from both co-facilitators what they experienced during the sessions, reflecting back in the conversation about the session, in terms of what ways each of the co-facilitators feel like they're being impacted, if they experience things the same way, and going from there. So really just emphasizing that co-facilitator relationship, and hearing a similar piece of the group that occurred from multiple perspectives can often really highlight when there is a countertransference reaction occurring, and then we can go deeper into the conversation from there, but really emphasizing the co-facilitator relationship.
I would add on to that. I have watched on on Thursdays, when all of the interns are present, and we essentially, I make sure to pause the tape and check in what is coming up for everybody as we watch this. And I do the same thing when we watch my own groups on the Friday seminar. And then I disclose even my own reactions that I'm having and what was coming up for me and what I was deciding in between. So definitely the conversations in the post group debrief and then watching tape and checking in and, well, what else might be going on here, and what other perspective, what is it triggering for other people in this moment, and having everybody kind of be part of that process.
Wendy, and are all of your groups video recorded?
Just the interpersonal process ones.
Mm.
So not the structured groups.
Since I supervise students in a group format, I actually have both the disadvantage and the advantage of it there being a group process that goes on within the supervision. And so there are issues of countertransference that come up, not just in the group, but also transference issues that come up in the supervision group, as well as parallel processes. So when issues of countertransference come up, they get kind of talked about and supervised. It's not supervised, supported. And there's a sense of cohesiveness that develops in the supervision group that allows for that level of discussion. One of the messages I try to convey to people is it's not a psychotherapy group, it's a supervision group. So the degree to which people want to or don't want to get into family dynamics that are getting triggered for them really needs to be treated in a very respectful fashion. But students are willing to go there when the group feels safe enough.
That's a really great point about the parallel process of development of the group supervision. Yeah.
Mm-hmm.
What other questions do we have? Well, I'll ask a question I've been thinking about. How do you evaluate trainees who co-lead with one another when you're not directly there? I mean, it sounds like some of you use maybe video recordings. I'm wondering if you watch them just in group supervision or on your own as well. Is it challenging to evaluate trainees and have a sense that you know what's actually happening in the group that you're not witnessing?
Even that I do both, I would say that it's a little bit different in the ones that are not recorded. I think in the ones that are recorded, I can see it, and sometimes I can pick up on things and give feedback in areas that they didn't bring up as part of the process. In the ones that are not recorded, I actually rely a lot on their co-leadership and what I'm seeing in our group supervision. And also there's a point in the semester, a couple of points where I check in and I have them speak to each other's strengths, and then have them speak themselves about, well, how do you want to be more like your co-leader, and what areas do you want to kind of, develop a little bit more? So when they start to get, a theme is I throw a lot of anxiety at them, when they start to get comfortable in their co-leadership and their leadership style, I say, okay, well, what do you want to do different? And what do you see in your co-leader that maybe you struggle with a little bit more, and kind of frame it as part of that discussions as an ongoing process. I also do that with the interns whose tapes I watch, but then I have a little bit more data.
Sounds like you do watch tape on your own or not.
I try to. Before I became assistant director, it was my goal to watch at least one or two of their entire groups during the semester. Since tacking on another role, that has been a little bit more difficult. So I make sure that then I'm much more sort of strict about we're spending 10 minutes watching tape for each of the groups and then discussing in group supervision on Thursdays. But but yeah, so I try to, that is my goal, with the time limited options of the center, sometimes it's not possible.
Things to add from you, Shemika, or you, David?
I personally have an aversion to the word evaluation.
Okay.
I leave most of that the individual supervisors, but when I'm kind of evaluating somebody, it's really more about the progress that I see them make, more than whether they're successful in their interventions or successful in their group leadership. I oftentimes actually have to remind them that they're in training, because they also oftentimes feel the pressure to get it right, to do it right, to have it go well. And so for me, evaluation is really more about seeing the progress they make in the comfort that they feel in being in that role.
Yeah, I think it's definitely challenging not being able to directly see what is happening. But I try to piece together sessions from what the co-facilitators share in the supervision space and what's written in the documentation. And I try to emphasize that it's very important to be clear in the documentation about what's happening so that someone who's not a part of the session, i.e. me, can get a good sense of how the session flows. I'm also co-facilitating with each of the interns while they're co-facilitating together. And so continuing to work on their skills and see them in the co-facilitation in the group with me, I can have more confidence in how they're then transferring those skills, especially when it comes to a process group. With regard to the more skills groups, the more structured groups, I meant to say, they can share, the curriculum that they're using or whatever materials they're using, in addition to sharing how things go in a session. So I can really get a better sense of how that looks in session by seeing what material they're actually working with. And then in support group spaces, it can be it falls in between the two in terms of how challenging it is to feel like I'm getting a sense of what's happening in the session. With a therapy group, there is much more happening at the process level that if it's not being spoken to and if it's not being observed, it may be missed. Whereas that process piece can occur in a support group space, but it, creates less of a different dynamic in the support group space. And so for me, it's just, it depends on what type of group it is. And I am moving towards exploring what it might look like to have our group sessions recorded so that in the future, I will be able to utilize that in the supervision process.
Shemika, clarifying question. You mentioned that you will co-lead with an intern in addition to them doing another group like with their peer. So how many groups is it typical for an intern to do like during the training year? And then we're talking about, my guess is psychology doctoral interns.
Right. So the default is that they will do at least one group for the entire year, and they're paired with me in the fall, and they again default to continuing in that group for the full year. But if for any reason they would prefer to co-facilitate another group with a different staff person, they can do that as well. And in addition to that, they can add a second treatment group. Some of our trainees also do drop-in groups or workshops, skills groups that are more on the outreach side, not with a set roster, not an assigned therapy responsibility to the clients. But in terms of treatment groups, the minimum expectation is one throughout the year with a staff person. I've also had each of the interns that I've co-facilitated with, to generally stay in that process group for the full year. So there have been a couple who have chosen to co-facilitate a different group in the second semester, but usually it's continuing in that group with me for the full year and adding a second group in the spring semester. When we have folks who come in with experience and with a passion for a group and who can advocate for themselves to co-facilitate 2 treatment groups starting in the fall, I also encourage that. So it would be outside of our norm, but definitely something that I encourage interns to try advocate for if that's a part of their treatment goals, to facilitate 2 groups from the very beginning.
We have time maybe for one more question. Well, I'm wondering about anxiety for trainees. And is there, it sounds like anxiety is different for trainees co-leading with each other versus them co-leading with a staff member. Are there things that you like that help trainees with an anxiety, or maybe you can speak to the difference in anxiety you see trainees co-leading with the senior staff versus with their peers?
My go-to try to help them lower their anxiety is share all of the ways in which I was a horrible group leader at the beginning of my training. Like in my first ever group experience, getting feedback from group members that they forgot that I was there because I spoke so little. And kind of really bringing it back to really normalizing the anxiety and highlighting kind of what David shared a little bit earlier of your training. This is your first time doing this. I am not expecting perfection in any way, and really removing me from any sort of pedestal that they might have me in because of my I'm the group coordinator, and really talking through, like I also struggle with this, or my group also struggled to make last semester. I run a group with 3 people instead of 8, and really highlighting ways in which what they're feeling and what they're struggling with is very normal.
I like to just try to understand the anxiety. I'm a big fan of understanding anxiety and resistance. And almost every time when somebody starts talking about their anxiety, we can use it as a parallel to what might be going on in their group. So for example, I just had 2 new students join our supervision group, and virtually everything they said about the anxiety that they felt about joining could have been said by a new member of a therapy group. And so we kind of use that as a recognition of the understandable nature of their anxiety and how it's something that they can learn from in terms of what may be going on in the group that they're either running or the group they haven't started yet.
Thank you, David. And thank you all panelists. We're at the end of our time. So thank you all the participants. Again, the recording will be available between 1 to 4 weeks, not sure when, but it will be emailed to you with using the email address you used to sign up for Zoom. So thank you all.